Hey y'all, welcome to episode 3 of GYNspirations. I'm Dr. Kristin Oates, and today we're going to dive deeper into the subject of fibroids, and we're going to talk about what you don't know about fibroids. Fibroids are benign, which means non-cancerous, tumors, which means growths that can occur in or around the uterus. But what you may not know is that our symptoms can vary depending on the location. So today we're going to talk about the various locations of fibroids. In the last episode, I shared with you all that I suffered with infertility secondary to submucosal fibroids. So we're going to start there. Submucosal fibroids are those that grow in the innermost layer of the uterus. It's called the endometrium. The endometrium is the layer of our uterus where our period blood comes from, and it has a direct connection to our vaginas. And so fibroids that grow in that layer can oftentimes cause heavy bleeding because they have a direct connection to the vagina. Very painful periods because the uterus is a muscle, and when it contracts and it's got a boulder in the middle of it, it causes pain. So oftentimes, submucosal fibroids cause heavy, painful periods, the passage of large clots, and infertility, as I talked about in the last episode. The second subtype of fibroids are what we call intramural fibroids. Intramural fibroids grow in the muscle layer of the uterus. Do not let this term intimidate you. That muscle layer is called the myometrium. So already you have learned that the inner layer of the uterus is called the endometrium, and the outer layer of our uterus is called the myometrium. So the fibroids that grow in the muscle, in the myometrium, which are called intramural fibroids, these are the fibroids that oftentimes will cause pressure and heavy bleeding, again, because that muscle is trying to contract every time we have a period, and it's got a growth that is preventing it from contracting efficiently. Okay, so that is intramural fibroids. Those cause heavy bleeding and oftentimes pelvic pressure and pain. The third subtype, and there's another, but we're not going to go there, we're going to keep it very general. The third subtype of fibroid are those that we call subserosal. Subserosal fibroids grow in what I call for my patients the skin, or the outermost layer of the uterus. If you think about it, if these fibroids are in the skin of the uterus, they have no muscle confining them. And so these are the fibroids that oftentimes will grow extremely large and cause pelvic pressure and other symptoms because they press on other organs. So for the bladder, which sits directly on top of the uterus, oftentimes subserosal fibroids can cause urinary frequency and urgency, and they can cause constipation because, again, they are blocking and impeding and growing unchecked in the skin layer of the uterus. So there you have it. Those are the 3 broad types of fibroids that we can have. So with that being said, if you have experienced any of the symptoms that I just described, I do not want you to be afraid. I want you to use this information to see your doctor or your healthcare provider. You have the vocabulary. You can tell them, no, I'm not experiencing the heavy bleeding, but I am experiencing urinary frequency and urgency, or I am experiencing really large clots and terrible pain, or I've been trying to get pregnant and it is not happening. And for years and years before this, I had heavy periods. And that doctor or that provider should offer you an ultrasound. But what if they don't? You can request, that's called advocacy. You can request that they give you an ultrasound. You have that right. And when you go in informed, you feel empowered because you've got the information and you are ready to come and ask questions and to get the answers that you deserve. Remember that freedom in your body is your birthright, but having the faith that it can happen is what makes it possible.